A 56-year-old motorcyclist involved in road traffic accident sustained displaced femoral shaft fracture. No other injuries are identified on the primary or secondary survey. The fracture is treated with closed IM nail, that means the intramedullary nail. Following day, the patient became increasingly agitated and confused. So the first clinical officer that agitated and confused on examination, he is pyrexial, hypoxic, and saturation of oxygen is 90% on 6-liter oxygen, tachycardia and normotency. And systemic examination demonstrates non-blanching petechial rash over the torso. What is the most likely explanation of this cause? So first of all, here we can see agitated and confused, that means the CNS involvement. The second one here, non-blanching petechial rash, that means it is the skin involvement or hematological involvement, and on the other hand there is respiratory system involvement, that means the saturation is 90%. So what may be the cause? Here the options are pulmonary embolism with paradoxical embolus, fat embolism, meningococcal sepsis, alcohol withdrawal, and chronic subdural hematoma. So what may be the answer option? First of all, here see the fracture, that means the fracture of the shaft of the femur, and it may occur due to the road traffic accident or due to the high velocity injury. And here we can see this is the nail, which is the IM nail or intramedullary nail. So intramedullary nail, they are inserted through the medullary cavity, and here we can see the finally the recovery from the fracture of the shaft of the femur by application of the intramedullary nail. So what happened in the bone marrow when we giving the nail? In the marrow cavity, we know there are the yellow bone marrow. So huge amount of the yellow bone marrow usually present within this femur. So we insert the white bone marrow during the insertion of the intramedullary nail. Here we can see the cross section of a long bone, and here the different part of the bone, including first of all here we can see this is the epiphysis, also in the lower part epiphysis, that means the proximal and distal epiphysis, and in the middle part there is the diaphysis. And here we can see in the medullary cavity there is the yellow bone marrow present here. This is the yellow bone marrow. So this yellow bone marrow, it is the normal content of the medullary cavity, and when a nail is introduced through this medullary cavity, actually this yellow bone marrow is compromised or insulted or injured. Now see the fat embolism. The triad of symptom of the fat embolism, they are includes respiratory, neurological and skin. So this is the respiratory, neurological or hematological or skin. So in case of respiratory system, what happens? The partial pressure of oxygen or oxygen saturation will be decreased. It's some important neurological symptom and the petechial rash. So in case of fat embolism, keep in mind that there is the definitive lung injury, that means lung fissure, also there is the brain fissure, and also there is the skin fissure, that means the petechial hemorrhage. So this three component is essential for the fat embolism diagnosis. So what happened in case of the fat embolism? First of all, there is the neurological symptom. Second one, there is the lung compromisation, and also there is the petechial rash. So we have to find this, and here we can see they tends to occur after the first two symptoms. That means the first two symptoms are the respiratory and neurological symptom. And other option there, that means the meningococcal sepsis. In case of the meningococcal sepsis, there is usually not associated with hypoxia, that means oxygen deficiency. And in case of pulmonary emboli, this is not associated with pyrexia. So when there is the pyrexia, there is the respiratory compromisation, neurological disorder and petechial loss. They are the diagnosis of the fat embolism. So the answer is the fat embolism. Why? Because we deals with fat here when we giving the intramedullary nail. Here we can see this is the intramedullary nail. So when The intramedullary nail application, actually we insult or injure the yellow bone marrow which is present in the medullary cavity. And here the clinical feature, this is the agitated and confusion, that means this is the brain part, that means it is related with the brain. Then other examinations such as this is the pyrexia and hypoxia. This hypoxia, it is related to the lungs, and also there is the petechial rash. So the neurological symptom, number 2 is the lung symptom, and number 3 is the petechial rash. These 3 components are the diagnostic point for the fat embolism. And also there is another important clue, which is the intramedullary nail. And when we are giving intramedullary nail, actually it deals with the yellow bone marrow which is present in the medullary cavity. So our final diagnosis is the fat embolism.